Okay. Calling the Committee on Audit to order. Madam Clerk, please call the roll.
Commissioner Wilson,
Oh, we have tablets too, so please use the tablets.
Commissioner Killeen, Commissioner Garza, Commissioner Knizik, Chair Dobb,
Here.
you have a quorum present.
Thank you. Next item.
B, Chairwoman's remarks.
I don't have any. Next item.
C, approval of the March 26, 2025 and the April 23rd, 2025 meeting minutes.
There's a motion by Commissioner Killeen, supported by Commissioner Garza. Any discussion on the meeting minutes? Hearing none, please vote.
Motion carried.
Next item.
D, unfinished business. There is none listed.
All right, next item.
Item 1, under new business, forwarding a copy of the Office of Legislative Auditor General's Performance Audit Report on the Wayne County Sheriff's Office Community-Based Residential Rehabilitation Treatment Program.
Okay, I'm going to turn it over to our Auditor General, Marcy Cora.
Marcy Cora, Auditor General, and I'll have staff and our guests introduce themselves.
Will Hamner, Audit Manager.
Tequila Warren, Supervisory Auditor.
Maxwell Andrews, Legislative Auditor 3.
Good morning, Robert Dunlap, Chief of the Wayne County Sheriff's Office. Thank you.
Welcome.
What you have before you today, this is our performance report on the Wayne County Sheriff's Community-Based Residential Rehabilitation Treatment Program. And I'm going to turn it over to the audit team, and they will briefly go through the findings in the report, findings and recommendations in the report.
Good morning again. We had two objectives for this particular engagement. One was to assess compliance with the program requirements, and the second was to evaluate the controls over the billing process. Our scope for this engagement was for calendar years 2022 and 2024. To address the objectives, we reviewed the contract between the Wayne County Sheriff's Office and the service providers to identify key compliance issues and operational procedures. We also examined invoices and attendance records and conducted sample testing to assess compliance with contractual and reporting requirements. Just background information on the program. The CBRRT program provides residential rehabilitation services to jail inmates as an alternative to incarceration for adult offenders diagnosed with mental health and/or substance use disorders. The program is intended to support successful reentry into the community and reduce repeat offenses while lowering the jail population. The program is funded by the county's general fund. During the years of 2022 through 24, we assessed there were 4 providers providing services to the program. Presently, the Sheriff's Office utilizes 2 service providers for providing program services. Summary of the audit, basically, we identified 4 issues and had 11 recommendations to strengthen the sheriff's internal controls over the CBBRT program. Recommendations, 1 issue is classified as a material weakness, 1 issue is classified as a significant deficiency, and 2 are classified as control deficiencies, which are deemed relatively low-risk areas. Both the material and significant deficiency will require, though, management's immediate attention to address those control deficiencies. I would, management agree with all 11 recommendations within the 4 issues. Tequila and the team will go over the summary of the engagement.
Okay, first summary, no attendance or sign-in sheets. 3 of the 4 providers use attendance or sign-in sheets for provided program services. However, the reported documentation was not consistent. Example, date, time, and signatures. The remaining provider did not use sign-in sheets. Instead, session attendance was recorded through a progress notes within the participants' charts. To enhance accountability over the program sessions attended, we recommend Wayne County Sheriff's Office management establish policy to ensure participants sign attendance sheets for all group and individual sessions. Enhance accountability by implementing a standardized attendance sheet to be signed and dated by participants and facilitators to verify session attendance. We also require providers maintain attendance sheets and provide support to monthly invoice billings. Management agreed with the recommendations.
Okay.
Uh,
I'm sorry.
So,
Go on.
okay. Accurate completion of administration jail release.
Oh, wait,
AJR
hold on.
forms.
Yeah,
Okay, let's discuss the
First one.
attendance sheet.
Okay.
Yeah, I just want to go through each one and have discussion on each one. So Marcy, did you want to say anything on that before I
Sure.
go to commissioner questions?
Right, and we believe that the attendance sheets are important because that's where verification and the supporting documentation with the invoices to ensure payment is for services performed. And I don't know if Chief wants to talk about the recommendation. They did agree to it in the response from individuals, but he may had some more comments to add.
Sheriff's Department.
Good morning again, Chief Dunlap. First of all, I do want to say thank you to the auditor and staff for the work that they did in identifying these issues and deficiencies. I also want to make sure that this honorable body is aware that the auditor's report actually support a audit that was conducted by myself, started January 24th of 2023, when I was brought in by Sheriff Washington and our chief of staff and our former finance director, and advised that there were some accounting deficiencies. And so the audit that I completed and conducted identified all of the issues that were identified by the auditor a year later, and we were in the progress of putting some of those very things in place. And so when the recommendation came to confirm that we had attendance sheets that accompany every invoice that come back, certainly we agreed because it was something that we had already identified.
Okay. Commissioner questions? So the analysis or the report says that contracts have been renewed for 2 of the providers. Do you know the provider that did not keep the attendance sheets, was their contract renewed, or is this just a timing issue? Do we know the contractor that did not keep the attendance sheets, are they up for renewal?
Yeah, so I must say that every one of the providers had some deficiencies in keeping attendance records. And the renewals of the other 2 that weren't renewed was because there was some additional paperwork that was required of them that I believe they have recently submitted. Our Director of Administration and Finance is Director Terry, who is en route. She can speak better to that. She got caught in traffic, but this wasn't just one particular vendor. I believe all of the vendors had some deficiencies in attendance keeping.
Okay, so potentially all 4 of them will be up for renewal.
Yes,
Okay, so we didn't just decide to not renew the 2 for whatever reason.
correct. I
Okay.
think certainly it was other paperwork that was required with regards to insurance and a few other things.
Okay. Oh, Commissioner Garza.
Thank you, Madam Chair. Good morning. Just have a question regarding, you said you completed an audit when coming in. How far back did you go as far as that audit goes? And for the duration of the program, just want to see how far we're looking back. Do we know, has this been going on and these deficiencies been happening for the entirety of the program? So I wanted to know that as far as how far back your audit went.
The audit that I conducted went back to, it looked at all of 2022. Prior to that time, and this program was being administrated under the supervision of our former Director of Administration and our jail population manager, who was formerly in my position.
Mhm.
when in January of 23, the sheriff and the chief of staff brought me in because basically we were running out of funds. And they wanted to understand why. And so that's when the sheriff put me involved in the process, along with our new director of administration, Director Terry. So I only looked at 22, and based on what I found from 22, it was enough to say that, you know, we need to do a better job of attendance keeping, reconciling our invoices. As I indicated, all of the things consistent with what the auditor found.
One question on the program. How long has this program been in place for?
Oh, wow. This program, I believe, went into effect in 2015, 2016. I
Okay,
don't have
So
the
about-
exact dates.
about a decade.
Yes.
Okay. I just, now I'll ask more questions later, Madam Chair, but I think this is tied in with a lot of the other things that we're going to hear. But I wanted to understand just how long this program has been going on for and how long we've known, or at least know from the audit findings that this has been a deficiency and how that leads into some of the provider invoices and payments that go to the providers. So we'll talk more about that later on, but I wanted to set the stage as far as how long this goes back to and how long the program's been in existence.
Commissioner Kanizik.
Thank you, thank you. First thing I'll say is, I know some folks are always tempted to respond to audits as if it's like a negative thing. I think it's a really good thing. Everyone is working with very limited resources and working really hard. So I appreciate hearing the sort of collaborative spirit between the sheriff's office and the auditors on this one. Maybe this is a question for, is it Miss Terry? Is that what you said?
Director Terry, yes.
Yeah,
Chief.
maybe it's a question for her, him, her, thank you. You don't know, I don't know.
Yeah, right.
The four service providers, do we know who they were, or is that something I should ask?
Yes, the four service providers are Team Wellness, Detroit Rescue Mission Ministries, Elmhurst House, and Christian Guidance Center, which is, I believe now, Naomi's Nest. Is Christian Guidance Center Naomi Nest? Oh, it's still Christian.
You have
Oh.
Women's Nest as well. They're all under.
Oh, they're under.
Detroit Rescue.
Oh, really? So Director Terry has joined us here. He asked about the four providers. I gave him Team Wellness, Detroit Rescue Mission Ministries, Lake Ridge. And Lake Ridge, Team Wellness, Elmhurst, and Detroit Rescue Ministries. Yeah. Detroit Rescue Mission Ministries.
Team Wellness 1,
Lake Ridge.
DRMM 2, Lake Ridge 3, and then Christian Guidance Center / Naomi's Nest 4.
No, Elmhurst House. So
No Christian Guidance Center.
they're
Naomi's
under
Nest.
Detroit Rescue Mission.
Okay,
Yeah.
okay, that's helpful. And then who are the two that have already re-upped?
Good morning, Commissioners. Vanita Terry, Director of Administration, Sheriff's Office. So the two vendors that we have active right now is Lake Ridge and Detroit Rescue Mission.
And then just talking about this initial piece on the attendance or sign-in sheets, you'd said it was something that you had identified as a deficiency in your audit. Have we implemented the change? Have we developed a standardized sign-in sheet? Where are we at in that process?
Yes, we not only developed that, but also we issued them a spreadsheet on how they shall report their invoices, and the spreadsheet coincides with the attendance sheet.
Okay, so for our intents and purposes, that audit finding has been addressed and should be smooth moving forward then.
Yes.
Okay, thank you, Madam Chair.
Marcy.
And just to add to that comment, we will be doing a corrective action plan where we will go back and follow up and make sure everything is implemented.
Okay, I think we can move on to the next
Okay,
finding.
thank you.
Mhm.
All right, Accurate completion of administrative jail release. We sampled 24 participants. 7 were released through the Wayne County Sheriff's Office Administration Jail Release and 17 VI court ordered. 5 out of the 7 AJRs, 71%, did not indicate whether the participant had a mental health disorder or substance use disorder. 6 out of the 7 AJRs, 86%, contain one or more exceptions in the condition of the release section, including misusing undated signatures, the participant signed in the attorney area, or the signature was unclear. To improve AGR accuracy and completeness, we recommend Wayne County Sheriff Office management implement a review process to ensure all required information, example, mental health, SUD status, participant attestation, is captured before release to the CBRT providers. Establish procedures to return AGRs with missing or incorrect information for correction before referral to treatment facilities. Management agreed with the recommendations. I'll now turn it over to Tequila.
Okay. Oh, before we,
Oh,
Move
you want
on.
to discuss it?
okay, yeah, let's have a discussion.
Okay.
Marcy, is there anything?
I just like
that you
that.
want
It's
to add?
important that for acceptance into the program, you need to have a mental health disorder or substance abuse disorder. That's why it's important that that's indicated on the adjudicated release form.
Mhm. Okay.
And then we'll make.
Chief Dunlap? Oh,
Yeah.
Will.
And also the the attestation by the inmate that if they don't complete the program, they would be subject to reincarceration. So their sign off is acknowledging why they're being referred and what their responsibilities are. Would that be fair to say?
That's correct. When that paperwork is completed, all staff clearly know that it should be clearly indicated why the person is being administratively released from jail to treatment, either for mental health or substance abuse. And the inmate should, sign indicating that they are aware of that, as well as what the penalties are for noncompliance. And to that end, as I indicated, the population manager, who was formerly the chief of jails, held my position, has been re-instructed with regards to being the person that managed that process. Not only will he ensure that those things happen, he will complete daily and weekly audits to hopefully, God forbid, identify if some, went out in error. Because a lot of this simply is both, I think, human error and a bit complacency.
Okay. Commissioner discussion, questions? Okay.
Okay, moving on to our second objective was to evaluate controls over the billing process. No method to validate provider invoices to supporting documentation found on page 9 of our report. We noted that the WCSO does not validate provider invoices and CBRRT providers do not submit attendance records or sign-in sheets to support the amounts billed. Our third recommendation, a significant deficiency. To strengthen controls over CBRRT invoice payments, we recommend WCSO management, A, establish policies and procedures to validate monthly invoices, B, use a standardized attendance sheet to verify enrollment and attendance, which is to be submitted with each invoice. C, consider a modification to JMS or the jail management system or some other system to track provider assignments and participant entry and exit dates. Management agreed with the recommendations.
Marcy.
This one it ties into the first recommendation about the sign-in sheets, but then it also takes another consideration. The JMS system could be a way to track the inmates to whichever provider they're in. I don't know what the feasibility of a modification is, but that could be a good way to track the inmates. And just to make sure we have the supporting documentation, everything's in order before we're paying invoices.
Chief?
Yes, again, so with regards to the financial end of it, part of the issue was the jail operations staff would verify the invoices and then send to Director Terry staff finance to pay off. Since that time, myself and the director have gotten together. And as I indicated before, the attendance spreadsheet as well as the invoice audit will address that issue. The vendors now will report to us what we owe them on the spreadsheets that we provided. That will come into jail operations staff, who will verify it for the finance team under Director Terry. When it goes to the finance team, they have their own process where they will verify the information that was verified by jail operations staff, specifically ensuring that the inmates that we're paying for went out on the day that the jail put them out. We have documentation to verify that they went to the provider that submitted the invoice, and that they went either for substance abuse or mental health treatment. And when those invoices come back, they match up with the information on the AJR form, as well as with the attendance sheet for each day billed. Director.
In addition to that, my staff has been instructed to always verify our blanket order, because we have those funds allocated for each vendor, and to ensure the number of days. So they kind of been provided a template, as you will, with the key points. You have 45 days that you're able to be in this program. So any vendor that bills us outside of those 45 days, that will be kicked back to the program administrator for him to contact the vendor, and we'll discuss that. So there's more of a second check now at this time, instead of just paying off of an invoice that we receive.
Well, and Marcy, I know
You have
you want to
questions.
say something, and then I have commissioner questions.
Correct. Just, again, we applaud you guys for moving forward with that corrective action. But one of the first recommendation was that and it sounds great, right?
Mhm.
As far as the business practice. But one of the first recommendation is that you establish this into policy. And the reason we make that recommendation is that in case, you guys move on from the county, that your subsequent individuals will be able to follow that process.
We will implement that.
Yeah, actually, we're actually in the process. I have a draft that the director and I haven't had a chance to go over. We actually talked about it last week in preparation for this meeting, but there will be a written policy.
Marcy.
This one's not related to the actual recommendation, but it has to do with the renewals of the other two. Based on page 5 of the report, for the two that have renewal, it's $815,000. Will there be enough funding for provider B and D once a contract is?
Most definitely it will.
Okay, questions from Commissioner Kanizak and then Commissioner Garza.
Just on the third one about that recommendation for a system modification, I would anticipate that any sort of system enhancement would have a cost associated with it that probably was not budgeted for or anticipated. Has that dollar value been gamed out so that we might be able to consider it as we go through the budget making process?
And thank you for that, Commissioner Kanizak, because you're absolutely correct. We do have the JMS does show that these individuals actually went to residential treatment. And I believe in the system, it's listed as facility 8. However, I think what the auditor is saying is facility 8 should identify each individual vendor. And that is a build out, and we have not yet determined what that cost is.
Okay.
So I'm seeing the hard copy documents, the Excel spreadsheets.
Okay. If and when you have that cost at hand, feel free to send it our way so we can contemplate that and try to be helpful. Thank you, Madam Chair.
Commissioner Garza.
Thank you, Madam Chair. One of the items that were mentioned were on the report where providers do not submit attendance records to support amounts billed. And I know that you mentioned invoices coming in, going to the administrator's office, but how were the billings validated in the past if that wasn't occurring, since matching up the attendance with this in order to pay those out is something that's needed. So I'm trying to figure out how that was validated in the past.
Well, I can tell you, however it was done, it wasn't done the way that it should have been properly done. The information and feedback that we received from staff when we got involved was not acceptable. And the bottom line is they didn't have the proper documentation.
Thank you.
Okay. Okay, let's move on to the next one.
Lack of oversight resulting in overbillings, found on page 10 of the report. We selected a sample of 24 participants listed on 12 invoices from the 4 providers. We compared attendance records to the days billed, noted any differences, and recalculated discrepancies using the per diem rate. We found the CBRRT providers overbilled the sheriff's office by $6,150 for our test sample. Because our sample was only 20% of 63 invoices billed by the providers over our scope period, the amount overbilled could be higher. Recommendation 4, a material weakness. To strengthen controls over billing and approval, we recommend the Sheriff's Office management, A, develop formal policies and procedures for the invoice review and approval process. B, assign dedicated personnel to oversee invoice reviews and supporting documentation. And C, implement periodic audits to identify and resolve discrepancies and systemic issues. Management agreed with the recommendations.
Marcy.
And as you know, our audit is based on a test of a sample test, you know, because it's to look at the control environment and identify deficiencies and recommendations. But a thought is cost analysis to determine if prior billing should be reviewed, to prior billing should be reviewed to see if there are any additional costs that were not properly billed, and then what would be the possibility of recouping those costs.
So again, through the chair, back in January of 2023, when Sheriff Washington brought myself and Director Terry to the table, again, we were not directly involved in this process, but that's when I began doing an investigation of the issue. You may recall I said at the top of the meeting, it was mentioned by the Chief of Staff, we were running out of money. And through our investigation and research, we found that we were not running out of money, that we had in fact overpaid some of the vendors. And we, at least for my investigation, went back to all of the beginning of 2022. And we put in a process to, one, identify the exact total amount, which I think we're still verifying. And we also put in a process to recover some of the overpayment. And I don't know the exact number as we sit at this table, but I believe we have recovered about half of what the sheriff had overpaid in 2022. And we discovered that certainly we were not running out of money and did not need additional funds.
And to add to that, I think based on discussions with the audit team and yourself during the engagement, you found that you guys were paying for the court-ordered individuals that was coming out of the.
Thank you for that. As the auditor indicated, that was another era. You know, during the COVID pandemic, we actually reduced the jail population from 1,700 down to below 800 because we involved directly the courts and the prosecutor's office and the defense bar to identify, you know, the most vulnerable population who could be administratively released based on charge and issues such as mental health and substance abuse. And I believe, again, unfortunately, I think some staff simply became a little complacent in that they started diverting to treatment on the sheriff residential treatment account, individuals that were court ordered that should have never been paid out of the sheriff's residential treatment budget. I don't know that we'll be able to recover that cost simply because the court didn't have a budget. And I guess the court, you know, viewed it as, well, we didn't tell the sheriff how to do it. And so as long as those people went to treatment for mental health or substance abuse, I do believe it was in the spirit of the contract, but the contract is not set up for the sheriff's office to pay for court-ordered treatment.
Commissioner questions on this? Commissioner Colleen?
Thank you, Madam Chair. And good morning, Chief.
Good morning, sir.
So you did an audit, Auditor General did an audit. You found you were being overbilled. The Auditor General found that. So a question for both of you. In your audit, with the 4 providers, was it evenly spread among the 4 for overbilling, or was 1 or 2 providers more susceptible to this?
So I believe from my audit, it was based on volume, in terms of how many participants. And so all of the providers does not provide the same services.
Right.
Like Lake Ridge, for one, who overbilled us the least amount because they didn't get as many participants as, say, provides the substance abuse counseling and treatment, whereas Team Wellness do both mental and the substance abuse issues. And so it's kind of spread across the board, Commissioner, if you will.
Yeah, but it's checking boxes. We provide this service, we provided that service.
Yes, sir.
Did anything stand out to you about any of the providers overbilling more than others? I understand that it's different services and all that.
Well, one of the things that stood out to, I think, both myself and Director Terry is, I believe the last iteration of the contract made it very clear that the providers were budgeted a certain amount, and they also had responsibility for making sure that they don't go over that amount without notifying us. And so we made sure that that was reinforced in the revised version of the
So your
contract.
contract
There's
says
dependent.
you're going to provide these services,
Yes.
3 units of this, 4 units of that, or whatever. And then it's up to the provider to say, hey, we're going over.
Correct. We have responsibility
Yeah.
for making sure that we don't pay them over the amount.
Right.
And then they also have a responsibility that they don't accept additional people if they've already reached their allocated dollar amount.
Hmm.
And unfortunately, that wasn't being enforced the way it should be.
And did the Auditor General in their audit notice were any providers standing out for overbilling?
To your point on page 11 of the report, and Will may want to speak more to it, there is a schedule that shows the $6,000, 115. It's broken down. All 4 providers did have overbillings. They range from $724 to $3,250. And it could be based on the volume, but each provider did have overbillings.
Yeah. Of course, there's different, yeah. Well, and that's always an issue
Yes, sir.
with providing these services and social services and people with and if I may, Madam Chair, this is titled residential rehab services. So are they going to a residential facility? Where are the services being provided?
Yeah, it's a community-based residential treatment, but it's not a house, if you will. It is, some of the providers, if not, well, all of them have, say, apartments that they have repurposed for substance abuse and mental health treatment, residential treatment. And so they're not going to live in someone's house, if that's what you
They're
ask.
not going home.
Correct.
They don't get to choose where they go. The provider has a bed and a
Correct.
inform or whatever. Okay. And the 45 days. They're like, we're going to give you 45 days. What's the 45 days about?
So prior to this audit, the original contract allowed for 90 days of residential treatment.
Mhm.
And as a result of our investigation and research, we had determined that 45 days was pretty much the maximum amount of time. And that was based on feedback both from our research and what the provider themselves recommended to us as well. And so we reduced it from 90 days to 45 days. And we also saw that as a way to get more people into treatment without increasing our budget.
So after 45 days and all the boxes have been checked,
Mhm.
what happens to the individual?
Well, hopefully the providers are providing wraparound services. We know
They go beyond the 45 days?
correct. And so a lot of the providers will, if there is federal funds available to provide that, extended continuing care, if you will, it's like, signing up with a doctor or therapist. Okay. They, as we all know, you cannot collect, be funded by Medicaid while in jail, but if a person is outside of the jail, they can be reconnected to Medicaid, and all of the health benefits and services will be available to those individuals. And they may do a contract, a plan directly with the provider, or get connected to another provider, because we do know.
The individual
The
does that.
individual, yes, sir. Substance abuse.
And then they
recovery
bill
is on.
Medicaid.
I don't know exactly how each
Okay.
provider do it, but from what I know, in a lot of cases, yes.
Okay. So after the 45 days, what happens to the individual? Let's say they have successfully completed their residential rehab. Where do they go?
Again, if they are not under any charge or sentence and they've completed their 45 days, my guess is they go home and continue their aftercare follow-up with a provider that they're connected to. They don't come back to the jail.
The mental health or SUD issue is identified when they show up at the Wayne County Jail?
Yes, so.
Before they're not because when you say not charged, I mean, they're at jail, which usually means they have a charge of some sort.
Yes, a lot of these individuals come, so if they're under like pre-sentence, pre-trial charges, they still have their obligation to the court. And so when an individual gets booked into the Wayne County Jail, every person is assessed by jail health. And jail health, if they determine that, say, Charlie Brown was booked into the jail for breaking out the window in Greektown, and Charlie Brown, doesn't have $1,000 to bond out, but we know Charlie Brown doesn't even realize where Charlie Brown is, the health provider in the jail will conduct an assessment, and they might even determine, hey, this is a good candidate who would be better served in treatment outside of the jail. That information, will be passed along to the court if the court hasn't already identified it.
Yeah.
And then the jail health provider will do what we call a mental health discharge plan, so that when we administratively release these people, say to Team Wellness know what the issue was, what the findings were. And so there's a warm handoff from the jail to Team Wellness, and they know what type of care or treatment this person is in need of.
I gotcha. And the court is the one that signs off on a residential rehab?
If it's court ordered,
Yeah.
but under the jail consent order,
Yeah.
it allows the chief or his or her designee
So you
to
do it.
identify individuals such as Charlie Brown. And as we're currently structured, my predecessor is now our population manager, who works with our jail classification and registry team to screen our population every day and see how many people fit in the Charlie Brown category.
Commissioner
And you
Coyle,
can do that without a court order?
I'm gonna bring this back to our item on overbilling. What was your question on overbilling?
Want me to wait for these questions until the report is done and then ask them?
I think we're on the discussion of, the item on overbilling.
I have another couple questions, but I'll wait until we're through with this part and then ask them.
Okay. Commissioner Knizik.
The 20% that equated to the $6,150. You kind of, do I have that right? Right. You know, you kind of extrapolate that out, $30,000 potentially overpaid. Chief, you had said that to date, you'd believe that roughly half of what had been overpaid had been recouped by the office. Do we know what that number is in terms of how much you've gotten back so far?
I don't know the exact amount, but we can, submit it to, the commission later if you
Okay.
want that information. And again, as I indicated, the monies that were spent on court order treatment, we probably won't recoup that cost. But as it relates to the providers that receive people who were not court ordered, that monies, we hope to recover all of it.
And then I don't think this is for the sheriff's office, maybe our audit team or our budget folks. Is recoupment the only available mechanism that we have, or is there future payment offsets or other strategies that we could pursue if and when the time is right? I just don't know I guess what levers are available to us.
I would say that all of the recoupment through future payment strategies, I have seen that in the
Okay.
past.
Okay. And then it's not germane, but I'll be very, very quick on it. Chief, you had said 1,700 inmates in the jail pre-COVID, dropped to 800 using the appropriate strategies during COVID. Do we know what the population is at right now in the jail?
Yeah,
Roughly.
I believe today we're somewhere around 1,348, 1,350 we've been averaging.
Okay.
And I didn't look at the population today, but I'm pretty comfortable in saying that that's the accurate number.
Estimate's fine with me. Thank you, Madam Chair.
Thank you. Commissioner Garza.
Thank you, Madam Chair. And Commissioner Knizik stole my thunder on that question, so I'll continue on with it. But no, I just want to thank you all, first of all, for our audit team and also the Sheriff's Department for identifying this and working to correct it. I think it's as you mentioned, this program has existed for quite a long time before you all were there, before the sheriff was there. And looking to correct this is a very important part of the process. And recovering payments, as the commissioner mentioned as well, is also an important part of this. But maybe this is to our audit team or whoever can answer it, is, looking at the audit findings in this report that we've been presented as the commission audit committee. How are we going to look at prior years? This has existed for nearly a decade. I'd imagine there's some type of issue with just looking at this audit and how we're correcting it now. How are we going to go in to look at those prior years and to see exactly how maybe potentially there were funds that were issued that maybe shouldn't have? And I think it opened up a can of worms in this one, is to look at how many years we go back into how maybe this was happening in prior years as well. So I think that's my question, is how do we look at that? Because I think it doesn't just stop at 2022, right? I think we have to look at this as a program and how it's functioned over the time and in its entirety.
And can I piggyback on that question with, so the 4 providers we have now, have we had those same providers for how far back have we had those providers? Yeah.
No, not all of them.
Like if we
Lake
had
Ridge
different
and King
providers, are we
Wellness.
gonna look back at those? We're done with them. I don't know that we can
Yes.
recoup those costs.
Right.
Yeah.
Yeah, Lake Ridge and Team Wellness were the latest ones to become a part of this program. And I don't know the exact years, but
Okay.
they weren't part of the original group.
Okay.
Sure. Yeah, and that's a good point. I mean, I think we've, and we have those vendors, providers that we have currently. But I think if we're going to continue to use those providers, however long any of them have been issuing, been a vendor for this, for the county, I think we need to make sure that we're looking at those years and ensuring that if we're going to continue doing business with these providers, that we're making sure we're looking at cost recovery for them if we're going to continue doing business with them, because I think that's an important part of us, holding them accountable, holding our departments accountable, and looking at that is for future use. And if there's other vendors that are still out there that we don't currently use, they come back later on, I think it's important to identify who those folks were and make sure that we're doing our best to recoup any dollars that are possibly could be eligible to be recouped.
And so we don't disagree. I think also what we have to consider is a lot of the staff that was involved in this, because this wasn't just on the provider side, it was also some on our side, and a lot of that staff is gone. And I'm not sure exactly how we would address that with, some of the fault being on the sheriff county side.
Got it. Understandable. I think, and that's just a question that I wanted to raise.
Yeah.
Right. I mean,
Okay.
I don't have a solution to that, but I think it's something that we should be giving thought to, as to what's the best. And I'm not saying there is an answer to it. I'm saying we need to look at, how we're and again, going back to my original statement, I think we're moving forward in a positive direction, but also gives me heartburn as, someone who lives here, who's from the county. I think we have to take a look at if there's any avenues to go down that route.
Marcy.
I could just add to the discussion when Will and Mr. Hammond and myself met with the chair, that was a discussion we had. And I think we need to take into consideration the cost benefit analysis of how far we want to go back, maybe even statutes limitation. I don't know what all plays into it, but I wanted to also add, my 27 years here at the county, contract oversight and monitoring, I think, has the highest risk to the county, because I know the county is so short of staff. And in our audits over the years, we found this is the area with the greatest risk, because you don't have the manpower. So that's why you've got to have good internal controls in place to prevent some of those overbillings. And I know over the years, we've had many audit reports related to this. It's just monitoring of these contracts and controls are just so important.
Yeah. So in our, in the corrective action plan, could we have an answer on what your department's going to do with the overbilling if you're going to go back a year, 2 years, whatever you decide is best to look at, and how you're going to handle that?
Through the chair, we have addressed this when I came on board in February of 2023 with the sheriff's office. That summer of 2023, once the analysis was done, we sent certified letters to all our vendors indicating the overpayment amount, and moving forward that we were applying any future invoices to that overpayment. So I do have a schedule, and as Chief has indicated, we have staff that has moved on, so it's going back, and then we had the cyber attack where the file was housed, that we have to rebuild that file. So I need to have my staff rebuild the file, verify the numbers, and we could get that information over to you. But each and every vendor received a certified letter. It had the amount and how we would move forward to recoup those dollars. And we do still have a credit balance, which each vendor. However, we have not been using the service as much right now because we've been identifying, using other services out there right now until we get back where we need to be.
Marcy.
And like I said, 30 days after the report is received by the full board, we'll request a corrective action, and we'll make sure that assessment is included in our corrective action.
Excellent. Okay. Any other questions? Okay. Okay. Anything else on this report?
I'd just like to add, I think Commissioner Kniezek hit it head on, that, working together as a team with the auditees, how our office has felt that this is the way to strengthen controls in the county. I just wanted to thank the sheriff's office for working well with us to address these, because sometimes it takes other eyes to looking at something that, you're not doing every day. So I think it worked well.
Definitely.
Welcome. And thank you as well.
Yes.
Yeah. Did you have something for conclusion? No, okay, no, okay. All right, do we have a motion to receive and file this, oh, Commissioner Kling?
If I may, I do have another question.
Okay,
Thank you, Madam Chair. Chief, I think you mentioned the term reincarceration in this program. Have people come back to the jail because they didn't successfully?
Yes, sir. Quite a few.
And I was going to say, how often does that happen?
Uh, so I can't give you definite numbers right now,
Gotcha, yeah.
but on occasion, um, every 2 or 3 months, you might find an individual who was released that didn't want to comply with the rules at the
Yeah.
facility, and we'll get a call and we'll go out and we'll arrest them and bring them back to the jail.
So do they get services in the jail then, once they come back?
They get what services are available in the jail, which obviously are very limited because we're in the jail, which is why this program came
right.
about through
Gives you more
you know,
options.
inmate commissary funds originally, because it provides more options for the individual to get a larger array of services while going through the adjudication process and staying positively connected to the community.
Okay.
And there, I might mention, there's no other program like this. I don't think the Auditor General found another program like this program anywhere in your research. Am I right or wrong? Thank you.
Yeah, it sounds unique. We don't go, do we deal with Detroit Wayne Integrated Health Network at all here? Where do they come in?
Absolutely. And so
Do they have to approve your providers or?
very, very, very good question, Commissioner. And so what happens as a part of the discharge plan before the inmate leaves the jail, there is, if you have a SUD issue, those people should be connected with a provider, get a participant number before they're released to the community-based residential treatment center. And once the community-based residential treatment facility connects them with the participant number provided by DWIN, they should not bill the sheriff's fund anymore because there's funding provided through DWIN, which is what Director Terry was alluding to lately. We've been connecting more and more people to those type of funds, and we have not released as many straight from the AJR jail community-based treatment funds.
So that funding that you receive from DeWin,
We don't receive it. The provider,
the provider does,
correct.
but that can begin on day one of their, when they're released. The provider can be getting payments through DeWin.
So I would tell you, ideally, we will hope that the provider is connecting individuals who are eligible within 72 hours. And once those individuals are connected to other funds, the provider shall no longer bill the sheriff's program.
Another level of complexity.
It is, and all of the providers have certainly been made aware of that. And the audit should also catch that as we move forward. And so as a part of my investigation, I also put in a request to DWIN to see if they can help us identify which of these participants were funded through them. But obviously, because of HIPAA issues, couldn't
Right.
get that information.
I got you. Thanks, Chief. Thanks, Madam Chair.
all right, we have a motion to receive and file this report by Commissioner Garza. Is there support? Okay, I'll take your word for it. Supported by Commissioner Colleen. Commissioner Colleen's gonna support. Oh, okay. Can you hit his button?
Got it.
Okay, although, if you want to vote on your tablet, please do so. Thank you.
Commissioner Wilson? Motion carried.
Okay, great. All right. Thank you for joining us.
Thank you.
Yes. Okay, next item, Madam Clerk.
F, such other matters as may be properly submitted before the committee.
We have none. Next item.
G, public comments.
If there's anyone here to make a public comment for the Committee on Audit, please do so at this time. Come forward, unmute yourself on Zoom or on the phone. Any emails?
No emails were received.
Okay, second call for public comments. And third and last call for public comments in person, on Zoom or on the phone. Any hands raised?
There are no hands raised on Zoom.
All right. Okay, hearing no public comments, next item.
Adjournment.
Is there a motion to adjourn? Okay, it's been moved by Commissioner Garza, supported by Commissioner Colleen. All those in favor of adjournment?